Hello everyone, my name is Sobi and I would like to welcome everyone to my presentation on leadership in clinical practice. Firstly, here is the overview of my presentation. My presentation will talk about the definition of nursing leadership, its importance on clinical environment, and my preferred style of leadership and reasons for my preference. Finally, I will conclude my presentation by summarizing the contents. So let me start with the introduction of nursing leadership. So what is nursing leadership? Well, Cummings and colleagues have explained nursing leadership as a complex process of influencing others within a team or context to achieve shared vision and goals. This is supported by Australian College of Nursing, which states leadership is about having a vision and enabling people to accomplish a certain goal. Moreover, Kotter developed a definition in 1996 stating that it is about creating a change, mission, and providing motivation to others and overcoming political, institutional, and resource barriers. Given the numerous ways in which nursing leadership has been defined and explained in literature, many ideas have influenced my interpretation of nursing leadership. My understanding of nursing leadership is that it is about having a long-term vision guided by strategy, having the capacity to inspire, motivate, and provide support to others, being a role model and empowering teams to achieve mutual goals and shared vision, encouraging creativity and innovation, having clinical expertise as well as interpersonal skills to collaborate with patients and multidisciplinary teams. Giddens, Ward, Stanley, Cummings and colleagues. Well, now I've defined leadership of nursing, let me talk about how nursing leadership is significant in clinical environment. Nursing leadership is significant in clinical practice because nurse leaders play a vital role in maintaining healthy work environments, influencing retention of nursing workforce, enhancing job satisfaction, affecting patient outcomes and satisfaction as per Australian College of Nursing, Cummings and colleagues, Mackay, Lees and Larkey, Nagashi and Demesh. Has anyone felt like you've had a bad day or a bad shift just because of a colleague's negative attitude towards you or your work? Well, I'm sure the answer is yes. Now, one of the aspects in which nurse leaders can exercise influence is in the creation and maintenance of healthy and integrated workplace as per Mahoney and Galura. This is also supported by Brady Gurman and Cummings as they point out that nursing leadership styles can affect performance of nurse by allowing nursing workforce to not only work autonomously but also take accountability, provide support resources including education and professional development opportunities, enhancing work relationships and team culture. Moreover, Hutchinson and Hurley also highlight that a nurse leader's leadership styles can resolve and manage conflicts, encourage team members to work not only towards meeting the goals, but also committing to the organization's values and mission. Nurse leaders at unit level are able to make cultural and practice changes by being a role model, ensuring zero bullying culture, valuing feedback and ensuring well-being of staff, and consequently influencing staff retention and job satisfaction. Talking about nurse retention and job satisfaction, as per Cowden and Cummings, one of the factors in their models that led to intention of nurses leaving the job was abuse. Furthermore, Hodges stated that the factors that influences nurses leaving job are bullying, emotional stress, burnt out, lack of support, increased workloads, insufficient resources, and lack of skills. This is also supported by multiple sources such as Healthcare Workforce Australia, Rochi and colleagues, Cowden and Mackay, Lees and Larkey. I strongly believe that nurses should be able to work in a workplace where they are respected and appreciated for their contribution and patient load is manageable, where there are adequate staffing levels and skill mixes available. Nurses should feel supported and empowered by their teams and nurse leaders. Duffield and colleagues, Rochi and colleagues, and Hodges also support this as they add nurse leaders who have good listening skills and understand the need of nurses are able to create positive workplace. Also providing safe workplace and enhancing professional development by nursing leaders affect patient outcomes, nurses' physical and mental health, and promote retention of nurses and thus enhances job satisfaction. The other aspect which nursing leadership is really important is patient outcomes. Now, Wong and colleagues and their study have shown a strong correlation between strong leadership styles, quality of care, mortality rates, and patient outcomes. Positive leadership models have been linked to improve health outcomes and fewer complications in a variety of clinical settings. Moreover, studies have found that effective leaders have been related with reduced patient mortality, decreased hospital stays, fewer medication errors, and better patient satisfaction. McKay and colleagues also suggest that this is due to the reason that nursing leaders provide opportunities that enable nurses to achieve their full potential and perform their best even during arrival of unexpected challenges and increased workload. Now, as we've talked about the importance of nursing leadership, let me talk more about the leadership style which I prefer the best. Among many leadership styles, I prefer transformational leadership style because now, more than ever, there is a greater need for nurse managers to become skilled and expert clinicians, communicators and educators, team leaders, strategic and visionary, and nurse leaders need to participate in decision-making for the healthcare systems. And nurse leaders with transformational leadership styles are able to lead sustainable healthcare workforce and system in more challenging times yet to come. Literature have shown that the improvement of patient safety requires effective leadership style, and several studies by Lapallian, Giddens, and Wong have supported this. For example, many studies point out that the medication errors are not reported due to the fear of being blamed and due to non-supportive work environments, which is exactly the opposite of promoting medication safety. Thus, I like transformational leadership styles because in such scenarios where there has been medication errors, transformational leader encourages feedback, and thus appropriate feedback promotes learning from mistakes. Also, this leadership style motivates and inspires their followers, which affects their performance. Also, it focuses on relationship between team members, which assist in strengthening team identity and efficiency. Findings of study conducted by Cummings and colleagues show that investing into building relationship with nurses, nurse leaders could positively impact on the patient outcomes. Now, the next point is critical thinkers and creativity and innovation. Well, nurses are critical thinkers, and transformational leaders encourages followers to question and challenge assumptions. They encourage them to be creative and innovative in order to find new solutions to problems. So in my opinion, nurses should be open to changing ineffective systems, although being used for long periods of time. They should be open to new ideas. Working in a cardiothoracic unit in a hospital, in my experience, nurses are required to be visionary and have long-term vision. They need to be goal-directed rather than task-oriented. For example, historically nurses were often seen as handmaidens of doctors, as per St. Parbury. But as a registered nurse working in a hospital ward, I believe that nurses are involved in creating long-term strategies and visions for patient health outcomes. And this is evident in my day-to-day work, as nurses play a crucial part in identifying post-hospital care needs, and thus when nurses liaise and refer them to allied health and social services, they consequently enhance the quality of life and promote positive health outcomes for the patient even after discharge from hospital. Thus, it is very important that effective leadership styles are used by leaders in order to provide quality care to the patient and provide long-term solution to health problems. Now we've come to the conclusion of my presentation. In conclusion, the concept of nursing leadership focuses on others in order to achieve a shared vision and goal. As discussed in this presentation, nursing leadership has high implication in clinical practice because of the correlationship between leadership styles and its effects in workplace environment, staff retention and satisfaction, and patient health outcomes. It is clear from the discussion earlier that leadership styles have a huge impact on not only healthcare workforce, but also the smooth administration and management of organization and positive patient health outcomes. Thus, I prefer transformational leadership style because of its focus on enhancing relationships, empowering and supporting individuals, collaborating with teams, and working towards a shared goal and vision, which is vital in clinical environments for providing long-term quality and safe care. We've come to the end of our presentation. Thank you very much for listening, and I hope you've enjoyed. Thank you.